Welcome to my presentation, the detection of chemotherapy-resistant pancreatic cancer using a Glycan biomarker. A subset of PDAC is highly resistant to systemic chemotherapy, but no markers are available in clinical setting to identify this subset. We hypothesized that a Glycan biomarker called STRA could be used for this purpose. We first detect the STRA expression in PDAC cancer cell lines, A showing the structure of STRA in comparison to C99. Figure B showing the STRA and the C99 expression in 3 cell lines. In ASPC1 cells, STRA Cap2 express both, and PANC10.05 express neither. Figure C summarizes the expression of STRA and C99 in all the 27 cell lines. It shows that STRA expresses around half of all the 27 cell lines. And the Glycan expression in PDAC organoid, this shows that STRA and C99 express in most of the organoid. We also detect the gene expression in STRA versus non-STRA cells. Please note that the drug catabolic genes are highly expressed in STRA cell lines. And then we check if the STRA cell lines are associated with drug resistant. We test the drugs cisplatin, etoposide, gemcitabine, and fluorouracil. This shows that STRA cell lines survive better with the drug present in the cell culture. And then we further carefully calculate the IC50 value in STRA versus non-STRA cell lines. This shows for all the 8 treatment STRA value except oxaliplatin, which show no difference between STRA and non-STRA cell lines. The heat map summarizes as figure A, and C shows the genes that potentially contribute to STRA resistance. And then we generated the STRA gene signature based on the RNA-seq data for the 27 cell lines, and use this STRA gene signature to separate TCGA and ICGC cohort to STRA versus non-STRA patients. The survival analysis shows only the non-STRA patients benefit from adjuvant therapy. And the blood test also indicates that short survival patients tend to have higher STRA, and the patient's blood have the higher STRA level tend to survive shorter. This research demonstrates that the Glycan biomarker could have value to detect chemotherapy-resistant PDAC in clinical setting.